So good afternoon, people, beautiful people. Thank you so much for joining us for today's topic, Empowering Health and Community Sovereignty. My name is Cecilia, and I'm the moderator for today. And for the next hour, we'll be talking about how the COVID-19 pandemic has affected the physical, mental, and spiritual well-being of our community, lessons learned, and visions for a healthier future. I'm going to ask some questions from our speakers, but like I said earlier, if you want, please feel free to chime in with any thoughts or questions via the chat box. Before we begin, I'm going to tell you a little bit about myself and then introduce the panel. So I've been in the healthcare industry for about 15 years, initially in fundraising and now as a healthcare consultant with Wipfli, one of the top 20 accounting and business consulting firms in the nation. My work is focused on assisting rural and urban community clinics with operational issues such as licensing and certification through state and federal programs, and also trying to get them as much money as possible so that they can focus on the needs of their patients. I received a BA in Broadcast Electronic Communication Arts from San Francisco State University and a graduate degree in Nonprofit Administration from the University of San Francisco. And now I'm excited and honored to introduce our diverse panel of healthcare superheroes. Our first guest is Jane Garcia, who is the CEO at La Clinica de la Raza, a federally qualified health center headquartered in Oakland. In her 38 years as CEO, Jane has grown the clinic from a budget of $2 million to over $115 million with more than 1,000 employees. Jane is a longtime advocate and activist with a passion for preserving healthcare for all without regard to income or immigration status. In 2019, Jane received a Public Health Hero Award from her alma mater at UC Berkeley's School of Public Health. She also served on the board of the California Endowment for 9 years, 2 of those as the board chair. Our second guest is Chris Pearson, a practitioner in acupuncture, herbal medicine, bodywork, and mind-body-spirit counseling. Chris has more than 10 years experience in conducting diversity training with a deep commitment to sustainable community development and the liberation of all beings from the cycles of suffering. Chris received a Master's of Science in Traditional Oriental Medicine from the Acupuncture and Integrative Medicine College of Berkeley, a BA in Psychology with a minor in Religious Studies from San Diego State University, and an Oriental Body Therapist certification from the Pacific College of Oriental Medicine. He is a devoted husband and father of 3 boys and operates his private practice at Be WellNatural in Oakland. And then our third guest is Nia Ridgle, a licensed clinical social worker and faith-based therapist. Nia was born and raised in the Bay Area by a single mom and is a first-generation college graduate. She considers herself a mental health trailblazer, using her consulting practice, RC Wellness, as a platform for helping the people of the African diaspora with restorative healing and effective leadership skills. Nia currently leads 2 wellness brands, a sister healing circle and a 6-week wellness course for Black men. And without further ado, let's dive into some questions for our panel. So we recently passed the 1-year mark of the pandemic and have witnessed how the virus has increased disparities in healthcare for communities of color, like access to testing and access to the vaccine. And the effects have been pretty horrific. Black and brown folks and indigenous tribes being infected and dying at higher rates, and the overall distrust of the healthcare system. So my question to the panel is, how did the pandemic impact your areas of practice and the ways in which you cared for your patients? Jane, do you want to start us?
Sure. We jumped in right away. The zip codes where we draw the majority of our patients were heavily impacted. And in fact, of the 5 zip codes in Alameda County that were targeted as having the highest positivity rates, we served 3 of those zip codes. So we jumped in right away and started doing testing for our patients and then expanded that to the larger community. We also were one of the first, and it might be that we were the first community health center that was contracted with by a county, in this case, Alameda County's Public Health Department, to do contact tracing and investigation. And that turned out to be a really critical piece of the work that we were doing because of the number of immigrants in the community. And, for the last year, we have been fighting against the public charge that prohibited immigrants, or it went against immigrants if they used Medi-Cal or food stamps or anything like that. So our immigrant population was extremely worried and distrustful of the public sector. So Alameda County knows and respects that we're a community trusted partner, and they contracted with us. And to date, we've got about 2,000 cases of positive members of our community that we're managing. From there, we were able to pivot right away to be able to do vaccination as well. And so all of that started out really with no money, knowing that we would get some help eventually, and that's essentially what did happen. From the very beginning, when the shelter in place was issued, we had to pivot. So we went from in-person visits to mostly electronic telehealth, and we are behind in our telehealth infrastructure. In fact, I think the shelter in place was issued on March 17th. On April 26th, we had planned and we went ahead and migrated to a different electronic health record. So that was gutsy. It was a lot of work. It was, but it turned out to be really the best decision.
You migrated prior. I'm sorry. You migrated prior to the government actually allowing you to do so. Is that what you're saying?
I'm sorry. Say that again.
You migrated to this new healthcare system without, or the medical record system without the government allowing you to do so, or
no. It was planned, and that's a individual decision, and we just moved forward. We're a part of a network of 8 community health centers, and we're all on the same electronic health record, which is really beautiful in terms of collecting data and working together on that issue. But it just goes to show that we were behind, and we had to convert to an electronic way of providing services. So over 50% of our visits were now being conducted either through telehealth or by telephone. In some cases, our dental program, for example, our school-based health centers completely had to close down for obvious reasons. But it was really interesting. We were able to take actually the dental staff and the school-based health centers, and we trained them, and we redirected them to testing and tracing. And so that really mitigated the number of people that we had to put on leave. So that really worked out well for us. The other thing is that there's still the need, you still have to do blood pressures, you still have to weigh babies. And one of the other things that we were able to do is that, especially for our high risk senior patients, we were able to get them some equipment to be able to monitor their blood pressure, to be able to monitor their sugars. And so that's something that we were able to migrate quickly to. The other challenge for us was putting the safety measures in place for our own employees that continue to come into the clinic. And while, this is something that's not new to us, there was an uptick in terms of the requirements that we had. And so getting the personal protective equipment to our employees and restructuring the way the service was delivered so that we had people in the front greeting whoever was coming in, screening, and then directing was something new that we had to do. And it meant taking people away from the jobs they were doing to new jobs that they were now having to continue to work on. We had to design our program. We had to create call centers to be able to take calls from our patients, and also just being able to just reinvent ourselves, essentially. I think one of the biggest challenges for us was that a lot of the infrastructure, not just for us, but for the delivery system itself, didn't exist. So in terms of being able to do the testing and entering it into some kind of a system, so it got to the county, it got to the state, those systems were not existent. So as we went along, we were building them, and our foundation world was very, very generous to us, and we were able to create those linkages through foundational support. They were really, really amazing. So those were some
Wonderful.
of the things that we had to do immediately. But I will say just that moving our dental staff into actually doing testing really worked out for us. And one of the things that we learned is that, wow, they're really good at infection control. Imagine that. And so there, as a result of that, I think that our infectious control program is now much stronger, as you would expect.
Mhm.
But but for different reasons now coming from other parts of the organization. And I think the linkages, when you have dental and you have medical and you have behavioral health, sometimes you create silos. And what this did is what it unified the organization. But today, just to share with you, we've done over 20,000 vaccinations. We've done about 17,000 tests, and we're managing about a caseload of 2,000 people who have tested positive, who we're working with. And one of the other things that came out of that is that we were able to talk to those families and connect them to other resources that we brought to the table. Our partnerships with food distribution programs like Tribe,
Mhm.
housing efforts, and
Mhm.
I think we just created the wraparound services that we were able to secure and offer our patients.
Wonderful. Okay. That was a lot of information. Thank you, Jane. I mean, I know the impact that community health centers have had in every city, and without you guys, I just don't know what we all would have done in getting tested and now getting the vaccines. But I wanted to go ahead and pose that question also to our other panel guests. So Nia, would you like to go next? How has the pandemic impacted your area of expertise in mental health?
Yeah, this is a great question. And thank you, Jane, for sharing that information about the public health system. So I come from a different genre, but we're all in a helping profession where we're almost the equivalent of, I would say, frontline workers, but without the blunt force trauma.
Mm-hmm.
So in the mental health field, we got inundated with clients that are in need of services. I think prior to COVID, there was really no reinforcement around mental health. I think there were initiatives that were in place, but not where it was just stressing on a lot of people's psyche versus a pandemic happening and us having to, us as a community having to really do a quick shift. It went literally overnight from it being a rumor to it being an actual lockdown, right?
Right.
So I think that just in the psyche of the community being able to really transition really fast, we weren't set up for that. And so in the mental health space, I was at Kaiser at that time, and we got inundated with tons of mental health crises, whether it be from loss of job, just scarcity around the pandemic happening, people losing loved ones. It was just a lot of different heightened mental health difficulties that people were having to struggle. So what I've seen in the mental health field right now is us having to be really innovative when it comes to how we practice. Right now, a lot of therapists are 100% telehealth, myself included. And that was different to practice because we didn't learn how to practice over the internet in school. It was always those modalities were taught in person. So we had to do a quick shift. And I'll just share a quick story. When I was working at Kaiser and if the first thing happened, I went to my supervisor and was like, what are we doing? Like, what's happening? Like, what are we going to do? And he was like, he looked at me and he said, I don't know. Figure it out.
He told you to figure it out.
He told me to figure it out.
Oh, wow.
But I think for the first time, I realized, wow, there's no experts.
Yeah.
Like, we were all going through something at the same time, but everyone was looking for direction. And that's where I had to take a really deep introspective look at how am I going to advance myself as a practitioner outside of being led by others, right? So that's a little caveat of what I've experienced as a professional. as a community, we are still in a mental health crisis because a lot of people have not been able to get the mental health services that they need to even deal with the psychology behind COVID happening. And so we're seeing an influx of people needing services and people having services, and then us opening the world up without having that equilibrium for us to really build a sturdy foundation.
Mm-hmm. Mm-hmm. Okay. Wonderful. Chris, do you want to go next? How did COVID and the pandemic impact your practice, especially, you know, being an acupuncturist? It's all hands on, right? You don't really have a choice of doing telehealth. I don't think so, but maybe you can enlighten us.
Sure. First of all, it's great to be here. This is an amazing panel. Listening to the varied experiences of the previous professionals is really harrowing, and at the same time inspiring. One of the things that we do as acupuncturists that's slightly different from the conventional biomedical model or mental health models is we contextualize information within what we would call a pattern recognition format. So there's a lot of gathering of information around how people live their lives. We see human beings more as verbs than as nouns, series of patterns that we seek to identify, like how do you move through space and time, and ultimately how does that inform your behavioral choice, and then your health outcomes are the result of patterns. COVID had a profound impact on the practice here because we're not a resource-rich practice. We're basically a family-run holistic health practice. My wife and I, at the time, were the only practitioners working out of this. We provided for the last 13 years a community-based opportunity once a month where we were providing service to service providers. Having been in the nonprofit sector for, as you mentioned in the introduction, for about 10 years, I realized to help people have platforms to help themselves. And so I wanted to create a platform where those service providers had a place to come in, and that cost was not a barrier to receiving complementary and alternative services, because oftentimes they're seen as like almost like a boutique healthcare experience as opposed to an essential. And because COVID put some major restrictions on our ability to move around, even though I was a primary care provider, I didn't feel comfortable having our community clinic where we would do a meditation. Sister Bathsheba, dear friend of mine, would lead a mindfulness class at the beginning of our day during our clinic. When we would do the community clinic, and then we would have services provided, cranial sacral therapy. My wife would acupuncture therapy. So after 13 years of a monthly clinic, we had to contract. And so for the last 13 months, we have not provided any of those donation-based services. What I've continued to do is offer our grassroots program to those folks who are in service to the community. They could take up to 40% off of any service. Because they're expressing financial need, not any need for documentation. We do not have the luxury of digital records. All of our records are on paper. All of my correspondence is, like you said, very analog, very in-person. As a primary care provider, I never closed my doors. I never turned folks away. Even in the height of all of the surges, I was here at the clinic. I think initially, to sort of answer the question more personally, there was fear. There was existential fear, first for myself, second for my family, third for my community, and fourth for the world. And those are all different expressions of identity. And so that I am not accustomed to living in fear. I'm not accustomed to, like, certainly I live in a structurally violent world as a Black man, and I am acutely aware of, you know, like the insidious onset of low intensity trauma all the time. I'm aware of that. I balance that. I have a special needs son who's particularly vulnerable. He's non-neurotypical and has cerebral palsy. So as a care provider, it's not just important that I'm taking care of my clients. It's important that I'm also taking care of myself. And so what COVID did for my clinic and for me personally was it exposed so many things. Like it laid bare before everyone's paused attention a structurally violent world and how those grossly and disproportionately impact the interpersonal exchanges of peoples of color and people marginalized by these structurally violent norms. So BIPOC, LGBTQ folks, like all of that came out. And so there was kind of an undeniable expression of what that trauma looks like. And unfortunately, I think, you know, we have a tendency to gravitate towards trauma porn. We put forward the sufferings of people and we get entertained by it and hopefully moved to social change. As we've migrated through these stages of the pandemic or the shelter in place or now the lifting, we've sort of gone through like, oh, wow, Black men are treated differently. Oh, shit, you know, because it started with Ahmaud Arbery and then came very quickly on the heels of that George Floyd, and then came very quickly on that, like all of these things. A lot of my white counterparts were waking up for the first time like, oh, shit, I'm white. And that's a conversation piece that has come up with a lot of my patients because I stayed in practice. A lot of the people who could afford to come had stable income. So the people who were, you know, wage workers or who were on limited income, my practice contracted greatly. And that wasn't the majority of my folks. So now I'm having conversations with, you know, white folks about being white that I was never having before. So in a lot of ways, I've had to scramble to put in place structures or scaffolding to have meaningful conversations about what it means to be human with people who've never had to ask. And so I woke up Black this morning, just like I did every other day in my life. And it wasn't new to me that these things existed. But what I think sort of goes undiscussed for a lot of service providers is we're asked to do the emotional labor of folks. You know, it's like we have to help you understand how my humanity is important. You know, and there's just like a couple of experiences that I had where people tell their spouses during a pandemic their whereabouts. Where are you going? What are you doing? Who are you with? These are, you know, inventories that we take now sort of for granted. Whereas before, coming and going was not monitored. It was just like, oh, where are you? I'll be home later.
Right.
So when a wife says to her husband, I'm going to get some acupuncture. Well, who are you getting it with? You know, where is that? And I can remember one conversation I had with a patient. She was like, I forgot to tell my husband that you were a man. And I said, well, why does that matter?
Right. Why does it matter?
And you know, that's kind of a naive question. I understand with a, you know, a structurally violent, misogynistic, patriarchal society why that matters. And I had to ask her as a white woman, like, why are you coming? You know, we want an intersectional future. We want to be able to interact with each other. Like, why are you coming? What are you here for? And if you're luxuriating in the fact that you're in the presence of a Black man, to have these conversations, to be physically touched by him in a safe and boundaried space so that you can work through your process, that's not like I've thought about that, but it was like in my face all day, every day, you know, as I would say probably 30 to 40% of my client base was white women, whereas before that was not the case. It was probably closer to 20%, because that's the demographic of people who felt comfortable leaving their home. That's the people who felt comfortable spending their money in that way. And that was the first wave. The second wave has been really refreshing and rewarding, and that is Black women, by and large, are realizing the importance of self-care. And they're forwarding and uplifting their commitment and care to themselves and seeking out support. And I think this is sort of one of the blessings of COVID, is we've identified that nobody can do it alone.
Mm-hmm.
Whether you're leaning on governmental institutions, or you're collateralizing into community networks, or you're leaning more deeply into your more intimate relationships, we're in this together. And it's not just virtue signaling to have on a mask. It's not just virtue signaling to go and get a vaccination. You're making a commitment to deepen your connection to your folks. And so that's been the biggest pivot for me in my practice, is seeing that, one, my practices daily have value, and that we need one another in order to continue to move forward. So that's kind of like my big takeaway from how has COVID impacted my practice and me on a personal level.
Mm-hmm. Mm-hmm. You said a lot of very profound things. Thank you so much for bringing to light the changes that have happened within your area of practice. I think that a lot of people don't understand and realize that acupuncture is it's an essential piece of healthcare for a lot of communities, and not everyone uses them, just like not everyone uses mental health, but acupuncture is super important. I know, Jane, do you offer acupuncture in any of your clinics?
A little bit. We have a volunteer that comes in. Yeah, but it's brand new and it's very limited.
Okay. So we talked about a little bit, I know, Jane, you also mentioned telehealth, and Nia, you talked about telehealth being as one of the better pieces of that came out of the pandemic, using telehealth as a means to see your patients. How do you think telehealth is leveling the playing field for marginalized communities at this time? How is it helping your practice? Because Nia, I know that right now you're no longer with Kaiser, right?
I'm no longer with Kaiser. I think for me, where I'm seeing the disparity and the uptake in both dualities, it's kind of like what Christopher was talking about regarding like access to resources, whether it be economically or just the ability to connect, and through understanding of knowing that these different modalities are out there when you're dealing with distress. I know for like a lot of my clients, so a majority of my clients are African American, or some form of on the diaspora, and therapy was a first priority for some, but a last priority for others. And a lot of my clients showed up during COVID in a lot of distress, and a lot of that was because of the stigma around mental health as it pertains to the Black community, because formally and traditionally mental health is seen as a weakness, as something that is wrong with you. And now during a pandemic, it was more so like we had a lot of what we would call high functioning people, which are people who are able to attain work and have a steady income enough to afford therapeutic services, whether it be through insurance or out of pocket, showing up and realizing like, hey, like in all of these areas, academically and professionally, I'm developed, but emotionally and mentally, I am struggling and I am having a really difficult time with performing. And so where I saw in the workplace, where I was having to support my clients, was they were asked to produce in crisis. And I think that for the first time, we had to like have a microscopic lens at, like, for example, I'll bring up the George Floyd situation and how that personally affected me when I was working at Kaiser. And it was a reason why I chose to leave. So the morning of that happened, there was no time for me to adjust at what just transpired and what I just saw. I had to like go right into work and then help others navigate a crisis that I was in with them, from a place of a professionalism, but really no resources for me. I was the only person in my clinic of color, but it's not like it's just for the wellness, the mental wellness department at all. It was like in whole San Jose. I was the only Black clinician, so you can just understand the type of distress I was under servicing my community, because at that time people only wanted to talk to Black clinicians about this issue. because it was a Black issue, and it was a very intimate issue that had transpired. And of course, by token, I'm the Black person. I'm a Black token person. So there was no type of consideration for me. There was just like, oh, you're the Black woman, fix the Black people, right? And then I had to make a decision in that to really practice self-care by talking to my coworkers about how I felt about being the only Black woman in the area that was a clinician, and no one coming to me for any type of consultation. No one came to me and said, Nia, how do we navigate this? How do we work through this? What are your thoughts? What do you think? How should we support our clients? Nobody talked to me about consulting on how to treat Black trauma. And to me, that was a really big wake-up sign to the fact that, and not to, offend anyone, I felt like I was on the wrong side, right? Because if I was at this high regarded titled job, then in that moment, not to be treated like an expert in the field of working with Black trauma when I'm the only person, that spoke to the volume of how valued I was at that position. So I chose to leave because I recognized in that moment that even in Black crisis, a lot of clinicians still felt privileged to treat Black trauma. And I felt like that was out of their scope of practice. And I needed to be really on the front grounds helping Black trauma.
Now that you say that, I don't know how many of our audience members feel comfortable with this, but I wanted to kind of take a poll, and you can just type it in the chat box. How many of our audience members experienced any type of mental health crisis or issues during the pandemic? And you can just say yes, you can, raise a hand, do something like that. I just kind of wanted to get an idea of what people were feeling during this time, because I know that, a lot of us were feeling a lot of a lot of issues going on out there. So while we get some feedback from our audience, Jane, do you want to talk a little bit about how telehealth, what you feel telehealth has done to the healthcare industry and how it's leveled the playing field for marginalized communities? Because I know one of the things is, a lot of, rural communities, a lot of people in low income areas, don't necessarily are able to go to the health center to get help. There's also issues with, insurance or paying for that care. So I just wanted to know what your thoughts are and how it's leveled the playing field.
I'm really excited about the possibilities here. I will say that for us, the majority of our patients connected with us by telephone more so than through a computer. And certainly the issues of having access beyond really surfaced. And so I think that's an issue that we're going to have to confront and figure out how to resolve. But in most cases, I think we had some really good results because people didn't have to come and battle and to find a parking space or to find out who could take care of their kids, or so it really helped in that sense. I think one of the struggles that we're having right now, and as a Kaiser member, I can get a telehealth visit anytime I want, and that was available to me way before the pandemic. So I think that this is a way to even the playing field. And I'm really excited that no matter where one of our patients may be, that they're going to have the potential to connect with us via telehealth. One of the struggles that we're having with the state that we're battling them on is that they don't want to authorize telephone visits as at the same rate, and they want to reduce the rate of reimbursement. But they're not any less effective than they're working just as well. And I've heard stories about some of our WIC patients, for example, who are able to complete their paperwork and not have to come in, meaning they don't have to leave work
Right.
and and so that's been a real positive. I do have a story where my one of my physicians had an appointment with, and it was late in the afternoon because that's when the patient wanted it. So he's talking to the patient. She's a senior citizen. How you doing? I'm fine. Everything's good. But here, talk to my granddaughter.
Mm.
Granddaughter gets on the call and she says, she's not fine. She seems disoriented and there's blood in her urine. I'm taking her to the emergency room. And is that, no, let's do this. Listen, I'm going to write you a prescription. You go get that filled right away and I'll call you in the morning and see how she is.
Mm-hmm.
Well, that call, which worked, avoided a costly emergency visit, not only to the family, but to the system.
Right.
So I think that's one of the struggles that we're going to have is battling that has to be part of the scope of services that we are able to provide. I think the other area where it's really going to help us is, our patients have a tremendous difficulty connecting to specialty care, as you can imagine.
Right.
And so I think if we can connect to via telehealth, where either the patient doesn't have to go there or the physician doesn't have to come to our clinic, that maybe our larger systems that have more specialty care are going to be more willing to offer their services when we can make appointments right into their existing system. I did also want to say that I'm encouraged because this pandemic really surfaced that we all, from time to time, have issues that we need some counseling on, that we need to talk to somebody else about. And what we found is that originally when we first started, there was some real hesitancy from our patients to do a behavioral health call on the telephone.
Yeah.
But that as time went on, they figured out how to get some privacy, and that improved. So I'm really excited about that piece. And I think it's just, we've got a long ways to go, but it is becoming a little bit more normalized than it was at the beginning of this pandemic.
Mm-hmm.
So it's encouraging news, and I think that it's going to let us go into deep into areas that perhaps we didn't have a presence and our patients didn't have access, and that I think that's going to change. But one of the things about this pandemic, that all the issues that we talk about when we talk about social determinants of health,
Mm-hmm.
they really surfaced. So we saw what inadequate housing does. We have a lot of multi-generational families living together. And what we experienced is that when one patient in that family tested positive, guess what? Everybody was positive.
Right.
And so all those determinants of health surfaced up, and it is going to continue to be an issue that we have to face. I also think, as I mentioned earlier, that we're a better system. This won't be the last pandemic.
Right.
We're not out of this one.
Right. We're coming up on our fourth, what is it? The fourth phase, the fourth,
yeah.
I forget what you call it. Yeah. So,
yeah. So the lessons that we've learned, the infrastructure that we've built in terms of being able to enter information into the registry, to be able to follow up more consistently and better, I think that it has had the impact of making us a better organization and hopefully a better system.
Wonderful. Chris, do you use telehealth in your practice at all? Or have you introduced that at all?
Use telehealth sparingly.
Mm-hmm.
A lot of diagnostic criteria is predicated on being in someone's physical presence.
Sure.
One of the things that occurs to me is the more proactive elements of health and well-being, preventative measures like consistent information regarding exercise, diet,
Mm-hmm.
the ways in which we manage our life, as opposed to a more reactionary model, have been the things that I have been forwarding in my conversations with. In a telehealth call that I had, it was someone who was one that's coming to mind is someone who was COVID positive, and apparently she had cleared the 10 days, but didn't feel comfortable coming out into public. And the thing that a lot of us have been getting, whether this is a standalone event or this is the first in the string of many pandemics, is we've been taught to react, not to be proactive. We don't have a real sense of what it means to be healthy. We have illness care. We don't have health care. We react, but we don't do a great job at structuring. So one of the things that I've been doing is outdoor intergenerational movement for proactive mental health and physical health care. So every Saturday I've been leading a workshop where we have a content area, and it's a physically distant workshop because we're outside, but we are doing things that are more proactive as opposed to reactive. I'm not treating people's illness per se, but we have an intergenerational model where we have people from 7 to 77 coming together to do physical fitness and have meaningful metaphysical dialogue about what it means to be human. And so that's really been my emphasis is not, reacting, but being more proactive. So telehealth has not been a huge part of my practice. Like I said, it's been nominal. I can count them on my fingers, the number of people that I've dealt with in that way. But from a family standpoint, that feels a far less like a telehealth application. Folks have been asking, well, what do I do? Well, what do I eat? Are there herbs I can take? How can I support my immune system? Okay, how many times should I wash my hands? Should I be washing my hands with? These are conversations that became commonplace. And as a healthcare provider, I was asked to interpret a lot of information and support people in navigating the seemingly endless fear narrative coming at us. Like, there's nothing you can do. You have to wait for there to be an immunization. There's a ton you can do. There's a lot of support mechanisms in place. You don't actually have to wait until the onset of symptoms to live a healthy life. And that's really been the redirect. My family has developed, multiple things. One of the things family has done is we do a family reunion call once a month now, and everybody shares best practices. Not only are we looking at like our ancestors in the spirit of Sankofa, looking backward, looking forward in order to be in the moment, we're sharing the best practices of what it means to be who we are. And so as a clinician, I think people in the community really lean on you more than they have before. It's like, oh, so what do I do here?
Sure. Sure.
Like, so it feels like every conversation that I have via Zoom or via the phone, it feels a bit like telehealth. I wanted to share one thing, Flourish Agenda. Are you familiar with the organization?
No.
So it works with folks of African descent, particularly folks who have been impacted by intergenerational trauma. And so we did a family camp. I was one of 13 facilitators. And so we did a telehealth conference where the families were outfitted with a hotel room and a digital connection. And the lead facilitation team of Spirit Works, Mizan and Siswe, masterfully led workshops. And then we, like as facilitators, did breakout groups to support families in unpacking intergenerational trauma. And so one of the things that Flourish did that I thought was phenomenal was sort of the incorporation of both telehealth as well as physical destination. So they were able to house people in a hotel, provide them with a computer, and then have them go through the process of unpacking intergenerational trauma. And they were all Black service providers and all Black facilitation team, and I believe 28 Black families. So there's a lot going on with regard to, staying digitally connected, but it was all, how can I say, just like more proactive than medical. So
Powerful. Wonderful. I remember in our conversations before this panel, both you, Chris, and Nia talked about the pandemic being one of the best years of your lives. So why don't you tell our audience why you said that? Nia, do you want to start?
Sure. And I'm looking at the comments in in the chat, and a lot of someone talked about being stressed, and I think that for me, I realized that I've lived a really distressed life, even in my desire to become a therapist. It was from systemic trauma, right? So I wanted to be the one to create that systemic change and add value to my community in areas that, you know, the therapeutic field is a white dominant male field. Me coming in as a Black woman, especially with having to own my voice and my value during a national crisis, was like a really life-changing experience for me, not only as a practitioner, where there's only 4% of Black clinicians, but also as a mother, you know, having to now homeschool children. And I'll be quite frank, like, I never wanted to be a stay-at-home mom homeschooling my children. Like, I literally chose to be a career mom, and my life was set up according to what I felt, you know, was my highest self. And we're talking about actualization, and I actually felt the evolution of me becoming a very mature woman and owning my voice and value and restructuring what it meant to be a professional woman, a professional Black woman, during a time where there's so many things being uncovered, redone, kind of smashed in your face. And I was sharing with, you know, a friend that, like, I felt almost like I was part of a civil rights movement. And I remember, like, the first time in 5th grade learning about all the, like, the freedom riders and things of that nature. And I was like talking so much the crap about that was me. I would blah 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 blah, right? So I'm like, when the pandemic happened, I was like, oh my God, like, I felt like I had like a personal experience of having to, like, speak up, you know, sacrifice, take risks, do so many different things. And when you're going through that emotionally, I don't feel like I was prepared for that. But in being open, and like I said, I'm a therapist that has a therapist. I spent the most money on my therapeutic and well-being I've ever spent, and that was because I really was focused on being a healthy practitioner. I realized, like, wow, I really never was taught to place value in my well-being. I was always taught to place my value in what I could produce for other people. And I never considered myself. And that's even in my parenting with my children, with just being able to manage stress and not feel like the stress had to be a part of my life, but really figure out, how do I sustainability by managing my mood even when the world is in crisis.
Mhm.
It's like a really, for me personally and professionally. And I think that the best thing I could have done was honestly jump off the ship when I left Kaiser, because it really helped me own my value outside of systems that I knew didn't serve me or people who look like me.
Nice.
Yeah.
Chris, do you want to answer that question as well?
Yeah, I'd love to. I'm reminded of, you know, when you're on a plane and they're just about to take off, they're giving you the safety check. They say, in the event of a loss in cabin pressure, first secure your mask and then attempt to assist others.
Right.
And like, that was for me, like, all the pressure left the building. So it was all about, like, what are you going to do? So I leaned into my practices, all the things that I had been studying. I leaned into those things. I immediately took my 11-year-old and began to hike. Like, that's what we did. I started taking my CMOS regularly, started studying more about Dr. Sebi, understanding a lot more about like indigenous technologies. I've been involved in all of these practices for 20 odd years, but I never really just had the time to be in them. So it was like, all right, well, you're not doing anything else. You're going to wake up in the morning, you're going to have your CMOS, you're going to take your kid for a hike. You know, I got maybe a third of my client base. So I got nothing but time, and unexpected free time is unexpected me time. So I'm out in the world literally living my best life. You know, I'm gonna eat the food that I know is going to build my intestinal flora and build my immune system. I'm going to spend time with my loved ones, my 3 sons. You know, my 21-year-old was stuck at the house, and anybody who's got a 21-year-old child knows you don't see them often. And when you do, you have divergent opinions about things that have value. So this is the first, you know, in his young adult life where we've been in total alignment. We've had the capacity to be like, okay, these are the things that we value as a family. These are the things that we value as individuals. These are the things that we want to forward in relationship. And we had a dope conversation. I'd love to share it. It was like, who do you have to be in the presence of someone? What's the ask? You know, that was a big, and it's like, if you like who you are in the presence of someone, spend more time with that person. And I'm not talking about the person who prompts you to be that, but who you get to be. So we were talking a lot about like the difference between opportunity versus obligation, you know, and so having these really heartfelt, meaningful dialogues with my 21-year-old allowed me to engage my 11-year-old in very similar conversations. My non-neurotypical child, he's 14, he's in diapers, and, you know, he's nonverbal and he requires care. When he's not in school, that means someone's on duty. For the first 9 months of the pandemic, we didn't have any support. So my wife was, you know, she was the homeschool mom. She was the caregiver. She was everything. But 60 days in a row, 60 days in a row, we had dinner together. Like, I've never had that in my life. We all sat down 60 days in a row and had dinner, and then played a game called Unstable Unicorns. And I played this card game every single day. And the beauty for me of the pause was, not only did I get a chance to like secure my own mask and help my own family, it helped me to understand the trifecta that we're going through. You know, we're obviously in a health crisis, we're in an environmental crisis, and we're in a structurally violent racist crisis. Like, those 3 things came into full view, and irrefutably so. So it always validated my last of my life's work. Like, you know, like, this is like, that's why you fight for what you fight for. That's why you do the work that you do. So for me, I got to look around at my community and the folks that I've built with and connected with, and saw the amazing work that they're doing. And I was like, yo, this is not a crisis for me. This is what we do. This is who we, like, this is our time. Go ahead and shine. And so I saw a lot of, you know, we like to call ourselves kings and queens, but shit, we carpenters and fishermen, and we everything. We're not just, it's not just royalty. I'm an everyday dude. And that's the thing that came to light for me. Was, my wife always says this to me, and it makes me laugh when I repeat it. She probably says it a lot less than I remember it, but she said, honey, you're special. Just like everybody else. So
Wonderful.
for real.
I'm sorry, Chris. I don't want to. I want to ask Jane this last question. We're running out of time, and I had other questions that I really wanted to ask you. But Jane, you know, you and your staff at the clinic, you're frontline workers as well. You know, was this the best year of your life, or was this one of the worst?
The best part of it was just that my bubble included my children and my grandchildren. My husband got sick in this past year, and to see how my children responded and kicked in was amazing. And it just made me feel like, you know what, we did something right here, because they were just amazing. I think the biggest lessons for me are at work. And because of the pandemic and the focus on clinical work, I had to step aside, you know, and let the clinical people do their work. And I'm not used to that. And so that was a big lesson for me. I think it all worked out, but it's part of understanding, you know, what is your legacy, Jane? You know, and building that up. So I think I saw a lot of people stand up and kick in and do some heavy lifting. And I'm really proud of our team, and my family did amazing. I'm not going to call it my best year, though. I'm not there yet.
I hear you. Well, you
Thank
all have you have a great legacy, Jane, and all of you. I just wanted to thank all of you for being out there and helping our community as you did. There's not enough. There aren't enough words to thank you and you all and everyone else that has helped pull us through this really difficult time. So thank you so much for being a part of this panel. Thank you to our audience for sticking around and listening. And you know, onward and forward.
Thank you to you, Cecilia. Thank you. You did a great job.
Problem.
Thank you.
And next, just, you know, for everyone else that's listening, the next session starts at 1:30. We've got Keep Oakland BIPOC. Is housing a right, a privilege, or an investment? And the power of culture and joy. So take care. Thank you very much.